Now, tomorrow marks World Health Day, and the World Health Organization is calling on countries to build fairer and healthier nations post-COVID-19. The coronavirus pandemic has highlighted the inequalities and the poor state of healthcare across the globe. COVID-19 also spurred on governments to relook at investments in the healthcare sector, as well as water and sanitation. Well, we're now joined by WaterAid Senior Policy Analyst on Health and Hygiene, Helen Hamilton. Her organization is calling on global leaders to commit more than $1 billion in new funds for the world's poorest countries to ensure proper and adequate clean water ablution facilities in hospitals and clinics. Ms. Hamilton, thank you for your time. Firstly, you did a massive survey, I understand, around how people feel about debt relief, things like that. What did you find?
So we found that there's huge public support for this $1.2 billion investment in water, sanitation and hygiene in healthcare facilities. And what we found was that there's massive public support behind taking action to support budgets being available for clean water in healthcare facilities. When WaterAid did a global poll of 18,000 people, 3/4 said that they believe that debt payments of the poorest should be suspended so that countries can invest in that best buy and make sure that their scarce resources are put into the real essentials of safe, dignified healthcare, such as water and soap, to make sure that we can fight COVID-19 and other diseases in healthcare facilities.
So you're not asking for rich countries to give poorer countries money, you're calling for the debt relief, but then there must be a trade-off, and that must be channeled to things like facilities and hospitals.
So we know that clean water, decent toilets, good hygiene are the absolute foundations of good quality healthcare. And making sure that everyone has access to those basic services is a fundamental step to not only creating healthier, more equal societies, but a healthier, more equal world. And as we're looking towards World Health Day tomorrow, we can't turn our attention away from this silent crisis. And so, given it's also the day that G20 ministers are going to be meeting to talk about how do we build back better from COVID-19, we're arguing that unless we bolster those all-important healthcare systems and protect our doctors, our nurses, our patients, and ensure that healthcare facilities everywhere have access to clean water, good hygiene and decent toilets, we can't look at planning for the next pandemic without putting those fundamentals in place. Because otherwise we're going to have a chink in our armour.
So rich countries can give debt relief, but how can they ensure it goes where you say it should go? Just the monitoring of that would be a cost, and presumably this assumes no government corruption at all in the beneficiary countries.
So as I said before, so WaterAid are calling for the G20 to commit $1.2 billion towards sanitation and hygiene for healthcare facilities. And if we look at that in the context of the amount of money that's been invested in COVID response over the last year, which is $20.6 trillion, that's only around half an hour's worth of spending. That's about the same length as a program segment.
No, but my question is, how do you know that the money will be used for that specific purpose if it's handed over or the debt relief is given?
So we know what we need to do, and we know where the investment needs to be targeted. We know that globally, one in four healthcare facilities has no clean water on site, and the situation in lower income countries is even worse. So we know that less than half of healthcare centres have clean water. And now that we have that data, we know where to target those investments. So we know what we need to do. We know that it is possible to do it, and what we need is action and commitment from governments to make those investments.
Okay, I still don't understand how it would be monitored, but also, I mean, when there are so many priorities, and like you said, so much money has been already spent, can this fly? Money specifically for water and ablution and things like that in hospital, it's laudable and it's a huge issue. But in South Africa, for example, we still have pit toilets in schools and kids have died. I'm sure many parents would want to start there.
So completely. So sub-Saharan Africa as a whole we know that less than half of healthcare facilities have clean water. But if we look at the impact that debt relief could make, if we take Zambia as an example, last year Zambia's paid over $2 billion in 2019 alone. And that's a staggering 11% of its gross national income. And it's since defaulted on payments. And more to the point, if we look at water, sanitation and hygiene, this is a best buy. It pays for itself in 1 year. It can help us combat all sorts of things like superbugs. It can help to pay itself back with shorter health stays when you're looking at hospitals. And also, if we imagine the impact, that's making health better for women, for children. It means that a mother going to deliver her baby can be confident that it's going to be delivered by a safe, clean pair of hands. It means that if you're going in for surgery, you can be confident that your surgeon has been able to wash their hands, and the same for the surgical implements that may be used will be clean. So what we're really focused on is the multiplier impact of investing in water, sanitation and hygiene. It will help us fight against COVID. It will help us be better prepared for other pandemics we might see. It will help us be better prepared for climate shocks. It will help us be better prepared to fight all sorts of infectious diseases, whilst also making sure that everybody has safe and dignified treatment, which in particular for women is what we know they want. When the White Ribbon Alliance did a survey around the world asking women what their top demand for healthcare was, their top two demands were dignified healthcare and water, sanitation and hygiene. So this not only has public support, this is what women are telling us that they want to see.
And yes, I think we'd all like it to happen. It's whether this can be pushed to the top of the agenda. I mean, explain before we let you go, how does the world of lobbying for good causes work now? Where do you take this request now? How do you get it discussed at that G20 meeting?
So we're working with many different organisations, and in the countries where WaterAid works, we're calling on the governments in those countries to raise this up the agenda, both for the G20 finance ministers meeting that's going to be happening tomorrow, but also throughout the year. So at G7, so we're calling on G7 governments to also input to make this $1.2 billion commitment towards water, sanitation and hygiene in healthcare centres. And this year also marks 2 years on from when the whole world committed to making water, sanitation and hygiene a reality at the WHO, at the World Health Assembly. So what we're focused on this year is calling on countries to really make sure that they keep that promise. It's a human right, it's an essential investment for healthy populations and society. And although $1.2 billion may sound like a large investment, in the grand scheme of things, it's a smart investment, it's a safe investment, and we know that it will pay for itself within 1 year. So it's an absolute win-win.
Yeah, hopefully the decision makers are listening. Thank you very much. WaterAid's Senior Policy Analyst on Health and Hygiene, Helen Hamilton.